It's your turn to help them now. We're here to show you how.
One of the miracles of modern medical technology is the pacemaker. The pacemaker is a small device about the size of a box of matches, which contains a battery and very fine wires. This device is implanted under the skin of the left chest, and the wires are snaked through the skin to the heart, and they're implanted in the muscle of the wall of the heart. The device administers small shocks which stimulate the heart to beat and generate enough blood pressure to keep a patient active, awake, and able to have a quality of life. Before the pacemaker, people who had diseases such as bradycardia, heart block, or sick sinus syndrome would have episodes where they would lose blood pressure, and from either falling or simply from not getting enough circulation to the brain, would die or become invalids. The pacemaker has allowed these patients to have a quality of life, to get outside the house and actually go and do the things that make life worth living. But the pacemaker does have issues, and it's important that you understand what it does, what it doesn't do, and how you can have some control. Also, we're going to discuss another device which is related, something called the implantable defibrillator. The defibrillator looks very much like a pacemaker, and sometimes it's combined with a pacemaker. It also is a battery-operated device implanted under the skin, and it is connected to wires that go to the heart. The function of the defibrillator, however, is to administer larger shocks. These shocks are administered when the heart starts beating irregularly, when the heart starts to fibrillate. Fibrillation is when the heart is beating irregularly so it cannot generate enough blood pressure. This is often referred to as a heart attack. A defibrillator can administer a large shock and can organize the electrical system in the heart so that it resumes beating regularly. The sensation, however, of receiving these large shocks, unlike the pacemaker, which cannot be felt by the patient, these large shocks feel like being kicked in the chest by a donkey, or so it's been described by many patients. Now, if a patient is actually having a heart attack, or fibrillation, as I said, then being kicked in the chest is worth it, because they're going to survive as a result of that kick. What I'm here to talk about, however, is what happens when the patient is approaching the end of life, and it is clear that they're not going to live that much longer. They're in their deathbed, they are at ease with the fact that they're going to pass away, and they are perhaps surrounded by family members. At that point, would they really want to be repeatedly kicked in the chest as their heart begins to fail? It's painful, it's undignified, and ultimately, it's futile. So what we're going to discuss is what to do about that situation. I don't think anybody would argue about the fact that a pacemaker or defibrillator in somebody who still has years to live and who has a quality of life and wishes to live is a miracle of modern technology and certainly should continue. But you should have a discussion with your parents about, is there a point at which they would want that defibrillator turned off? Is there a point where they have made their peace, and when the time comes and their heart starts to slow down, do they want the defibrillator off so they can go peacefully? It's important to discuss that with them. It's important to discuss that in advance so you don't have to decide, or rather they don't have to decide because it's their decision, whether they want it turned off at the last minute. Turning it off is a two-step process. It's very simple. To make the defibrillator not shock you is a very simple task. There's a special magnet that can simply be placed on the skin, and that will immobilize or disable the defibrillator until a technician can come with a more specialized magnet and actually turn it off. You don't need the permission of the cardiologist to put it in place. You can simply give the order to your primary care doctor or hospice doctor, and they, following your wishes, can obtain a magnet, have it turned off, and they can call the technician to come and turn it off wherever you are. You can also change your mind. If you happen to get through the illness or incident in which it looks like you're going to pass away and you recover, which would be wonderful, you can have it turned back on. There are ethical concerns that people will ask that are absolutely reasonable questions. What happens if you turn off the pacemaker? And remember, the pacemaker is the one that simply administers small shocks and keeps your heart going if it slows down or keeps it going at all times. And that's the one that you do not feel. It's different from the defibrillator. What if you want that one turned off because you want nature to take its course? Well, in many situations, if you turn that off and the heart is beating on its own, you won't notice any difference. There are situations, however, where your heart's beat is dependent on that pacemaker. In that situation, if you turn it off, the heart may slow down, and eventually the patient dies. Well, then what are the ethics of turning off that pacemaker? Does that mean you, as the reverse parenter, because you ordered the doctor to turn it off, have you killed your parent? No, you have not. There's been a lot of discussion about this. This kind of thing has actually been discussed for many, many years by religious experts and ethical experts and philosophers. Turning off a device that is a life-saving device is morally and ethically equivalent to never having put it in place to begin with. So, if your parent was going to pass away from a slowing heartbeat and you never put the pacemaker in place so that they died naturally, that is equivalent to turning off a pacemaker. And ultimately, the decision is going to be made based on what the patient wanted. So if your father or your mother said, "I want that pacemaker turned off," whether they say it right now or whether they instructed you years earlier, and they said, "I want that pacemaker turned off when I have no more quality of life," and you order that to be done, that was their decision. It is not suicide. It is ordering the discontinuation of a device which extended their life. And now they have the moral and ethical right to no longer continue that. This is a difficult question for a lot of people to absorb. So I don't expect to change your mind immediately. But it's something that I want you to think about. You can have a discussion with your priest, your imam, any of your faith leaders. You discuss it with your family, discuss it with your kids.
It's your turn to help them now. We're here to show you how.